Hello, my name is Larry Kilgore. I'm a GYN oncologist and happen to be the chair of the Department of Obstetrics and Gynecology. And my academic appointment is as professor at the University of Tennessee Medical Center here in Knoxville. The Department of OB/GYN has been around for a number of years. The department serves the East Tennessee region, parts of Kentucky and Virginia, and even a little bit of Georgia as an outreach for women's services. The department provides comprehensive women's services, which include basic obstetrics and gynecology, but also all of the 4 subspecialties of obstetrics and gynecology. We're very fortunate to have faculty who are fellowship trained in all of the subspecialties, and that includes my specialty of cancer, GYN oncology, the specialty of high-risk obstetrics, which is called maternal fetal medicine, the specialty of reproductive endocrinology and infertility, which has to do with conceptions and fertility issues, and then the youngest of the subspecialties is urogynecology. We have the only 2 fellowship-trained urogynecologists in East Tennessee. The mission of our Department of Obstetrics and Gynecology is to serve first the women of East Tennessee and their GYN and obstetric needs. Those range from young adulthood all the way to the geriatric population. We also have an important mission for education. We train OB/GYN residents, which is a 4-year residency after medical school, to be board certified obstetricians and gynecologists in our region. Lastly, but certainly not least, is our research mission scholarship. We have a robust research program in our department, led by Dr. Nikki Zeit, who's one of our vice chairs, and by Dr. Maples, who is our first PhD in our department, focusing on research. She helps with grant submission, research design, and implementation, and she's a great asset for our department. The faculty in the Department of Obstetrics and Gynecology include professors, associate professors, and assistant professors. That means we have young career, mid-career, and senior career faculty members. We need to train our faculty that follow us in leadership, and so we have a good variety of faculty members in the department. We have the subspecialties represented by faculty in GYN oncology, reproductive endocrinology, urogynecology, and high-risk obstetrics. And we have a great number of what one would call general obstetrician gynecologists who deliver private obstetric care to their patient population. We also serve through our mission those that are underserved. Appalachia has lots of underserved patients, those with lack of access to care, lack of access to screening, preventive health care services, and we are pleased to be in a position to provide care for them as their needs arise. The research in our department focuses on clinical research, that is, doing research that leads to improved care for the patient. I think our department would be considered among the leaders in reproductive health and family planning. This is led by Dr. Zeit, who has funded research to implement long-acting reversible contraception. She's been notable in conducting the research and also affecting policy change at the state level so that women may now obtain long-acting reversible contraception via an IUD immediately after giving birth. We also do a lot of cancer research in the Cancer Institute through our division in GYN oncology. We have a focus currently on implementation of the HPV vaccine. This is the first vaccine that was designed to prevent cancer. The cancers caused by HPV include head and neck cancers in men and women, and of course cervix cancer in women. Our research initiative, which was recently funded, is geared to improving the education of the dental hygienist and the dentist in our region. They have access to patients and can deliver an important message about HPV vaccination as it relates to head and neck cancers. Our research is trying to understand their knowledge, improve their knowledge and ability to give that message, and then finally get the vaccines available in our regional pharmacies scattered throughout East Tennessee. Well, I grew up in East Tennessee, over near Chattanooga. I was born in Chattanooga, but my parents, and I'm the only child, lived in Marion County, which is the next county over. My dad was an electrician and had a very small farm, which I grew up on. I initially wanted to be a veterinarian because I thought the vets were the coolest people I'd ever seen. But once I came to the University of Tennessee here in Knoxville, I quickly switched over to medicine and then attended the University of Tennessee Medical School in Memphis. My surgical training, first as an obstetrician gynecologist, occurred at UAB in Birmingham, and then my fellowship was also completed there in surgery. I was very fortunate to be offered a faculty position at UAB, where I was a faculty member for over 20 years before coming here 11 years ago. For fun, I play music. My mom and dad were both musicians. My dad was quite the fiddler, and my mom loved jazz and big bands, and she taught me how to play the guitar when I was a kid. So if I weren't a doctor, I'm sure I would have been in a rock and roll band for most of my adult life. Fortunately, I got an education and have been able to keep music as a fun hobby since that time.